whose pronouns are also she and her. We are members of the Bancha Language Justice Collective based in Bulbancha, Louisiana, also known as New Orleans. Bulbancha es la palabra Choctaw que significa la tierra donde se habla muchos lenguajes. Bulbancha is the Choctaw word which means the land where many languages are spoken. As language justice workers, we strive to create a space for everyone here to understand and be understood in the language in which we feel most powerful. Como trabajadores de justicia del lenguaje, nos esforzamos a crear un espacio para que todos aquí presentes puedan entender y ser entendidos en el idioma en que nos sentimos más poderosos. Today, again, we'll be providing simultaneous interpretation from English to Spanish and Spanish to English as part of our effort to create multilingual spaces. Hoy proveeremos interpretación simultánea del inglés al español y del español al inglés como parte de nuestro esfuerzo para crear espacios multilingües. Now, today we'll explain how interpretation platform works. If you're using a computer, you will see a globe at the bottom of your screen with the word interpretation. Click on it and select the channel with the language of your choice, be it English or Spanish. Si está usando una computadora, vas a ver un icono de globo al pie de tu pantalla con la palabra interpretación. Haz clic sobre él y selecciona el canal de tu lenguaje preferido, ya sea inglés o español. For smartphone or tablet, look for 3 dots that read more and make your selection. Para teléfono inteligente o tableta, busca 3 puntos que leen más, haz clic y haz tu selección. So to create this space together, a few things. Please speak at a slow and steady pace. If you're talking too fast, you'll see us do this signal with our hands, and that means to slow down. Please try to name your organizations with other acronyms. We try our best to have an accurate interpretation of those. Keep an eye on the chat in case we send a message to slow down or speak up. Keep your mic on mute when you are not speaking. If you have headphones, please use them. One speaker at a time, please, because the interpreter can only interpret one voice at a time, and we don't want to be in the position of having to decide which voice to privilege over the other. Ahora, para crear este espacio, júntese unas cositas. Por favor, hable en un paso lento y constante. Si está hablando muy rápido, nos verá hacer esta señal de manos para ir más despacio. Habla en voz alta y clara. Haremos esta señal con la mano si no podemos escucharte. We'll do this hand signal if we can't listen to you. Intente decir el nombre completo de los acrónimos, por ejemplo, de diferentes organizaciones. Trataremos de tener una traducción, una interpretación de esos nombres. Mantén tu micrófono en silencio si no está hablando y si tiene audífonos con micrófonos, por favor, utilízalos. Una persona a la vez, los intérpretes solamente pueden interpretar una voz a la vez y no queremos estar en la posición de tener que decidir cuál voz privilegiar sobre la otra. And lastly, please don't suffer in silence. If you have any questions or any problems hearing us or the speakers, please send a message in the chat. Por último, no sufra en silencio. Si tiene cualquier problema escuchándonos a nosotros o los presentadores, por favor envíe un mensaje al chat. Y gracias por su compromiso a un espacio multilingüe. Thank you all for your commitment in creating this multilingual space. See you.
Everyone, thank you for being here. And again, apologies for our late start. We have hundreds of people joining us. Please do feel free to use the chat box. And I hope that we can have your partnership to understand that we will do our best to answer those questions, but our commitment is that we will collect all of those questions and your ideas. We want your ideas too. We will collect those and respond in the next few days. We received hundreds of questions in advance, and so I hope that you will find this super informative. So definitely use the chat. We will answer in the next couple of days if we're not able to today. Remember to select your language channel, and we are ready to officially begin. Thank you. Sasha and Jacqueline, go ahead.
Greetings, everyone. I am Jacqueline Evans, and I am a child care educator from the state of Oklahoma.
And I'm Sasha Shunk, a family child care educator in Maine. We're so pleased to be here today, and we're thrilled that you are here today too.
Over 1,700 people registered for today's session from 47 states, including Puerto Rico and the District of Columbia. You submitted hundreds of questions about what's happening with the federal child care money and how we're going to use it together to do better for kids, families, and providers, whatever they are. Thank you once again for taking time for us today.
And for the past year, family childcare educators, we've been here every day on the front lines of the pandemic. We've stayed open when schools closed. We figured out how to safely care for and educate children while holding them in our hearts, if not our arms. We did it all on a shoestring that got shorter each day as our enrollments went down and our costs went up. And so we took on another role and advocated for ourselves and our families. We talked to state leaders, we talked to federal leaders, and then we did it again and again. And it worked. So today we are going to hear about our success, which brought $39 billion into childcare. So what's next? We will hear from some great folks about how we can make sure that family childcare is part of all rebuild and reform efforts in childcare.
Katie Hamm is not new to the childcare world, but she recently joined the Biden administration at the Department of Human Services. She is an acting Deputy Assistant Secretary for Early Childhood Development, Office of Early Childhood Development. Katie, thank you so much for being here today, and I'll turn it over to you at this time.
Hello, thank you so much, Sasha and Jacqueline. My name is Katie Hamm. I am joined today by my son, Nathaniel. He is 5 years old, and he is starting in a family childcare program this summer, where he is going to get ready for kindergarten. So we're both excited to be with you all today. We're joining you from Washington, D.C., the traditional lands of the Pecostaway, Natachian, and Anacostan people. And Nathaniel would like to say hello to you. So I'm going to let him do that now. Okay, it's your turn to talk. Hello. Okay, is that all you want to say?
I'm Nathaniel.
Okay, are you all done?
No, Mommy. Did you know about the Titanic disaster?
They do. Okay, good job. So as you can see, Nathaniel has been learning a lot about boats during the pandemic, including the Titanic. So I want to just thank you all first for having me today. I also want to echo what Sasha said. The family childcare community was, with no warning, asked to serve on the front lines of the pandemic, to serve children of essential workers, to serve children of families who either had to go into work in person or couldn't work from home with children. So I cannot imagine what this last year has been like. I know you all have put your health on the line to serve our country and our country's children. I know that the resources that you deserved have not been there, and I'm sorry that our country as a whole failed you in that way. But I am just so grateful for all that you have done to help us through this very difficult time. It's not over yet. There's help on the way. We're optimistic about vaccines. We've seen some parts of the country where COVID cases are going down and hospitalizations are going down, but we know that we still have a ways to go. So I want to talk just about a few things that the Biden administration has done in the first about 70 days in office to address the needs of the childcare community. And then I have some asks of you all. So the first thing I want to talk about is vaccine prioritization. At the beginning of the month, HHS issued a directive that included early childhood educators and specifically named family childcare, so that in pharmacies across the country and states, family childcare providers are a priority to get the vaccine. I know it's been difficult sometimes to actually get an appointment, but we are hopeful that in the coming weeks and months that will change. I also wanted to share a video from a family childcare provider who was able to get the vaccine in California and has been advocating for others to get the vaccine. Sorry, I need to slow down, I know. So I just encourage you to take a look at that. Take a look at that video. We also have a survey with the CDC that I'm going to put in the chat as well. We are asking anyone who is an early educator, family childcare provider, to please take that survey, whether you've gotten the vaccine or sought the vaccine. Go ahead and take that survey. The CDC wants information from family childcare specifically. Most of our respondents have been from center-based programs. So we are trying to get more information from family childcare. I encourage you, when the webinar is over, to just click on that link and it'll only take you a couple minutes. The second thing I wanted to talk about is CDC guidance specifically for family childcare. I know that it's been a year and you all have had to figure out social distancing, masks, sanitation, all of those things without enough guidance from the public health community. I am happy to say we have some specific graphics to help family childcare providers think about COVID mitigation and want to make sure that family childcare gets specific information that's relevant to the settings where you provide childcare. So I'm going to put that CDC guidance in there. And last, but certainly not least, the President and Congress passed the American Rescue Plan, which has $39 billion for childcare. And over the last year, that means we have $53.5 billion to rescue the childcare industry and invest in better ways. So in my office, the Office of Early Childhood Development, and within the Administration for Children and Families, we are working on getting that money to states and territories and tribes as soon as we can. We are also working on guidance that will demonstrate how those funds will be used. I can assure you that that guidance will speak to family childcare and be very clear that home-based childcare, family childcare is affirmatively included. So we are hoping that that money will be to states in the next month, and that not long after we can put out guidance to be clear on the role of family childcare. We are also thinking about not just we have resources. For so long, we have not had resources. And we know that the way we've invested in the childcare subsidy system in the past has not always led to policies that are good for children, that are good for families, that are good for childcare providers. So we want to think about how we can do better. So much of how we've done things in the past has been in an environment of scarcity. So we are encouraging states and tribes and territories, when they think about investing these resources, to focus on some of the policy levers that we really think will create systematic change. So that includes increasing provider payment rates so that they align with the cost of operating a childcare, including the standards that childcare providers are expected to meet, whether that's licensing or meeting benchmarks that your state has established in a quality rating system or something else. We also want to improve wages and benefits for family childcare providers and early educators. And lastly, we want to encourage states and territories and tribes to increase the supply of licensed or supported childcare in areas of the country where there's not enough, especially low-income communities. And that is something where family childcare providers and family childcare networks are absolutely a needed partner in that effort, especially when we think about culturally and linguistically responsive care. And when we think about providing childcare when families need it, sometimes that's in the evenings or on weekends, when many other programs that are in centers are not operating. So we look forward to partnering with you, hearing from you. I am a longtime fan of family childcare and have had an opportunity to interact with many of the leaders in this community, and I hope that that can continue. I want to make 3 asks of you. 1, take the survey and get the vaccine whenever it's made available to you. 2, share that CDC guidance and let us know what guidance or materials would be helpful to you. And 3, hold us accountable. If you are seeing things or hearing things that are not responsive to the needs of family childcare, please let us know. Please tell us what we need to do to be better. And with that, I will say thank you again for all you have done. I'm very, very excited about what's ahead. We have the opportunity finally to make real change in childcare, and we want to do that hand in hand with the family childcare community. So thank you.
Great. Katie, thank you so much for taking time on the Saturday to be with us. And I'll absolutely make sure I get that survey done after this webinar too. So Lana Dumas is the Executive Director of the National Association for Family Childcare. So Lana, I pass the mic to you.
Thank you, Sasha. This is such a great moment to celebrate. Today, we are here because you were heard. Every call, every email, every story you told about your high costs, about your stress, about your children and families, about the intense choices you've had to make to take care of yourself and those around you, you have been heard. President Biden recently signed the American Rescue Plan into law. This new law includes a big package of ideas and investments designed to help families who have struggled throughout the pandemic. The American Rescue Plan adds additional funds to the $10 billion invested in the Child Care and Development Block Grant in December, and the CARES funds from last March.
Oh, Lana, you went on mute accidentally.
I don't know how that happened. Oh my goodness. I don't even know where to start over at. Is it the $10 billion or the $39 billion? Where was I?
Go back to 10 billion just in
10
case.
billion. Let's go to 10 billion. So the American Rescue Plan adds additional funds to the $10 billion invested in the Child Care and Development Block Grant in December and the CARES funds from last March. This legislation includes $39 billion that advocates asked for together to stabilize childcare. The $39 billion invests in two ways. $15 billion for the Child Care and Development Block Grant, which helps families to pay for childcare, and $24 billion for a new Child Care Stabilization Fund that will help providers to cover their costs as they're waiting for families to return. This is for centers and for family childcare and for families. The legislation includes a lot of details and funds, and guidance will be coming from the federal agencies to state agencies, territories, and tribes. We don't know when yet, but we believe it'll be within the next month or so. At that time, states will have to make choices about how to invest in childcare centers, family childcare homes, and in support for families. We want to make those choices in some big, effective ways. We want to see investment in family childcare educators based on the unique needs and realities of family childcare and the families that are counting on you. And we want for all of family childcare, we want this for all of family childcare, not necessarily limited to those who've been in the childcare subsidy and assistance programs before. Family childcare educators, NAFCC thanks you for everything that you've shared and everything you've done to get this country to this point. We say thank you to the champions in Congress and all of their staff for all the questions they asked and all the ideas pushed to help get us to this point. And we thank the administration for leading with this relief proposal. This investment is to make whole so much of what was lost in the past year. It's also about setting the stage for a better future for family childcare and for all childcare and for those counting on childcare. One quick piece of new news, the PPP forgivable loans have been extended by Congress again through May 31st. We know people might be wondering if they should still be applying, and we're not able to give business advice on this call, but we encourage you to apply for all that you are eligible for. And while we won't cover PPP on this call, we will provide more information and resources. And I have to be very, very grateful because this call is a team effort. I want to thank the organizations that agreed to co-sponsor, to spread the word, and to be here today. AFSCME, SEIU, Child Care Aware of America, All Our Kin, 0 to 3, the Alliance for Early Success, and NAEYC. It takes every willing partner to help family child care to thrive, and we are here for it. A special thanks to our team at NAFCC for truly seeing family child care educators. And to the overwhelming number of you on Zoom and watching on Facebook Live, we are glad to have you here. Back to you, Sasha and Jacqueline.
All right, thank you so much. So again, thank you to Katie and Lana, thank you so much. As Jacqueline mentioned, over 1,700 people registered for today's session, and hundreds of you sent questions. So let's talk about what we know, what we don't know yet, and where we're going from here. We're joined today by Ann Hedgepeth from Child Care Aware of America, Lucy Ruscio from National Association of the Education of Young Children, Jessica Sager from All Our Kin, and Mary Beth Testa with the National Association for Family Child Care team. Oh, so sorry. I'm asking the next question. So first, Ann, can you tell us what Congress has approved? Can you walk us through some basics and how they apply to family child care?
Yeah, I'm happy to, Sasha, and I'm really happy to be here today with all of you who are on the call. And I just want to start by echoing my gratitude for the work that you all do, the families and the children and the communities you all support, and the advocacy we've done together over the past year in particular. That advocacy culminated in a tremendous investment in child care relief. And as Katie just stressed, those relief funds are structured to go to all types of childcare, including home-based and family childcare. But we are all going to have to work together to make sure that states make good on that opportunity. And so we're going to dig in a little bit today about what are the specifics about that funding so that we can engage in the kind of advocacy and conversations needed to make sure the funding reaches all of our incredible providers across the country. So the American Rescue Plan asks, split the child care relief money into two buckets. And it makes about $15 billion available to states to use through the Child Care and Development Block Grant. This is the program that you all know supports state subsidy systems and invests in the child care supply and quality. The new law includes very little detail about those relief funds, which means that states can do a lot of different things with that money. And this money is modeled after prior relief packages, like the CARES Act from last spring. As Katie stressed, that also means the money can absolutely go to purposes that will support family childcare. We're going to have to work with state policymakers to think about ways that this money can flow to family childcare. But I'll mention a couple of things that we know happened over the past year, maybe imperfectly in some places, that we may see states do again, and we may be able to do better this time. We know that states invested in things like reducing family copays, changing the way that subsidy payments are provided to child care programs, maybe using enrollment or contracts, and investing in technical assistance or resources for child care. We can do more and better with this money moving forward, and many of the organizations on this call have ideas about how to make that happen, and we want to hear from you. States have 3 years to decide how to spend this money and 4 years to get it out the door. This money is a great place to ask what worked well and what didn't. And I think that's a place where we want to continue the conversation in the chat today and with the resources we'll be developing moving forward. The other pot of money for childcare included in the American Rescue Plan Act is for a childcare stabilization fund. And basically, these will be grants to childcare providers from states. These grants can go to programs regardless of whether they've received another kind of assistance by participating in the subsidy program or receiving a grant last year, which is really important to note. That means a lot of people are going to be eligible, which is really exciting. And again, as Katie stressed, that also means the money can and should go to home-based childcare and family childcare. Qualified providers will also be providers who are currently open or ones who've had to close their doors because of the pandemic. Maybe they're closed temporarily as they deal with COVID-19 in their community, or they're facing some challenges. There are going to be ways to make sure the money gets to programs to support them with the costs they've had and the costs they anticipate moving forward. But what we don't know is exactly how states will distribute the funds, the size of the grants or the processes they'll use. And I know we all have a lot of questions about that, and it's a place we're going to have to stay tuned and stay in contact. While both the federal government and state leaders will have to provide more details, I did want to mention a couple of the uses that the money can go to, just to get us all thinking about how we understand the possibilities with this new grant program. The money can go to personnel costs, including payroll or salaries, and that includes compensations for employees and for people who are employees like sole proprietors, the folks who are owning their own businesses and may be struggling to pay themselves because of all the challenges we're facing. We want to make sure that's not the case. We shouldn't have to bear this burden alone. That can cover employee benefits and premium pay, or costs for employment, recruitment, and retention. The money can go to rent, mortgage, facility maintenance, and utilities. It can go to personal protective equipment, cleaning supplies, or training and professional development around health and safety practices. Providers will be able to use these grants for purchases or updates to equipment and supplies to respond to the COVID-19 public health emergency. They'll be able to use the funds for goods and services necessary to maintain or resume their childcare services, and to support the mental health supports for children and employees that we know are so critical after the immense trauma of the past year. And while grants in this fund will be able to cover costs from the past year of the pandemic, which would obviously be paid as a reimbursement, states must provide advance payment when the grants are covering expected costs. We think this is a really positive requirement, especially for small businesses that have been fronting so much money to keep themselves going forward to do the Herculean efforts it takes to respond to the pandemic and support the family, children, and communities you work with. So I wanted to make sure I noted that for us all. States have 2 years to decide how to use this money and 3 to get it out the door. We're hoping they'll act quickly. This money is about relief. So many of us, right, are running our businesses, but also are obviously individuals who are dealing with all the challenges of the pandemic. And so I did want to acknowledge that the American Rescue Plan has so much in it that might be able to help your family as well. Many families will see stimulus payments come in. They'll see an expansion of a child tax credit, which means that if you're a family with children, you may get additional payments throughout the year. There's an expansion of the child and dependent care tax credit, which will help with any costs you might be bearing yourself for childcare for your children or for other dependents. And there's an expansion of nutrition assistance through the Supplemental Nutrition Assistance Program and through the Program for Women, Infants, and Children, just to name a few types of additional assistance in the American Rescue Plan Act. While there are a couple of new requirements in the law, and I even mentioned that some of the details are spelled out while others aren't, the biggest feature I think that's new is that there is this stabilization grant program. And while states have done this before, We had not seen the federal government or Congress require these grants in the past. So we'll be getting that new program off the ground, and it'll happen in every state instead of just the ones who choose to do it. In addition, I'll mention that states are going to have to tell the federal government by December if they've been able to get those grants out the door. And so we'll get a sense of the ones that are doing the right thing and the ones that aren't, which can inform our advocacy. And I cannot stress enough the point that Katie just made. The federal government intends for this money to go to family childcare, and they're going to be providing more guidance to help make sure that happens, and we'll all have to work together to make it a reality. So I'm going to hand things back to Sasha and Jacqueline now to keep our program moving along.
Thank you so much. As you can imagine, the hottest questions are when and how much, and where do I sign up? Let's ask Mary Beth, can you help us with some of these details?
Yes, I will certainly do my best with what we know so far. We received hundreds of questions, and I see that you have very personal and individual questions. Do I count? Right, I think is what a lot of your questions come down to. So Congress, let's back up a smidge, and then we'll share some more. So Congress approved these funds. The U.S. Department of Health and Human Services staff and leaders will move those funds to the states, and that will happen. We don't know exactly when. We think it could be in the next month, that your state now has these funds available to start moving into action. So when will family childcare receive funds? That's not a known thing just yet, but the urgency is very real. And I think we want to, as advocates, balance this idea, Anne explained that they'd have some time before they have to spend the money, but you're standing here right now. And so we want to help good decisions get made that move the money quickly, move every dime of that money as quickly and effectively and equitably as we can. So your state has a lot of choices to make, and a lot of the answers to the questions receiving so far are that's a state decision. But let's recognize and embrace your state is not this sort of nameless, faceless decision-making machine. It's people. These decisions will be made by people who have questions too, and people that want to hear from you, even if they don't know it yet. But a lot of them do. They're asking questions. They want to know what the right things are. They want to know what the losses have been so that they can help solve, that they can help heal, that they can help invest in what you deserve. So your state will decide is the answer to a lot of these questions. But again, let's remember, these are people. These are people who will make these decisions at an agency, in the governor's office. There are also people who help educate and inform and influence those decisions. We are not alone in the family child care provider community having to ask and answer. There are so many more people every day that care, and I want us to be able to work together as teams in the states, the advocates who legislators know to go to when they have a question. We have an opportunity to make sure they're well informed with the facts about family child care needs and family child care realities. So again, when we say the state will decide, the state is people, and we can help. All of us, everyone on this call, everyone who didn't make it today, everyone who has been standing there this whole time being you, can help inform what those choices are. So we'll need to keep working together and keep listening for those opportunities to answer questions, and even help get some of the right questions asked, if that makes sense. They need to be asking, what's it like to be you? They need to be asking, what does it take for you to succeed? How many dollars does it take, right? How many supports and what supports actually matter to you? a big question on so many people's minds on this call and in our community is, will these funds go to those if I'm not in the subsidy program? And the intent is yes. And what's allowed at the federal level is yes. And this is where the people who decide in your state will decide how this goes. It can be for all of you. Years of too little funds in these programs mean we serve here and not here, and here but not there, and leave out too many. This is an enormous investment and an enormous opportunity. Your state gets, the people who decide things in your state get to decide now who counts. So let's make sure they hear from every one of you that you count. No one has drawn a line in the sand yet about who counts for this money. So let's make sure that they set it up in a really effective way. And that'll be true for the Child Care and Development Block Grant money and for the Stabilization Fund money. No one has decided yet who counts and who doesn't. So let's make sure as they put that together that they know who it needs to include. Back to you.
And yeah, well, that's right, Mary Beth. And you know, the details, they matter so much. And as you have alluded to, there are some questions that we just don't have answers on yet. But Jessica, I'd like to turn to you. And you know, what can we do to prepare for funds, even while we wait for guidance and more information from states?
Yeah, so first of all, thank you so much for having me. I want to take a minute just to thank the extraordinary family child care educators who are on this call. You have been truly incredible over the course of this very hard year. You have worked so hard to make sure that children and families have what they need. We see every day at All Our Kin how much you're doing. On top of that, you've advocated for funding to make sure that child care programs can keep going. The American Rescue Plan is a huge achievement, and every one of you deserves the credit for that win. Now, what comes next? Well, now, as you've heard, it's all about advocacy at the state level. Let's talk about what needs to happen. First off, we've got to urge state administrators to get dollars out the door and do it quickly. The top priority should be getting the money into the hands of child care educators. Second, we saw with the last round of relief funds that application processes can be really tough. Urge your state administrators to create applications that are as simple and straightforward as possible. Remind them that documentation of things like income and payroll may look different for family child care programs where educators may be sole proprietors or classified as self-employed. And tell them to make sure that applications are available in multiple languages and available to those who don't have computers or in some cases, special software. Finally, we've seen that technical assistance and support can be incredibly helpful to family child care educators. That includes technical assistance to help navigate the application process, to run your business during this tough time, and also potentially services like staffed family child care networks, coaching and consultation, and health and mental health supports. So with all that said, this is a really important moment to tell your child care administrators what you need and what families need. And you heard some great examples here from Anne and Mary Beth. I know there are so many skilled advocates on this call. Some effective strategies we've seen include holding town halls, hosting virtual visits, using social media, conducting letter writing campaigns. Please take the strategies that have been most useful to you and share them back with your peers and with us, your national partners as well.
And so, you know, just thinking about a few questions, specific questions, Jessica, will these funds be considered taxable income?
Yeah, so this is a really great question and a lot of people are asking it. Unfortunately, we don't know the answer. The partners on this call have reached out to the federal government for guidance, and we know that the state child care administrators and the states are reaching out as well. We know the uncertainty is tough, and we will let you know as soon as we learn more.
And Jessica, we've also heard from many in our community, can I apply for these funds if I'm undocumented?
Yeah, this is another really important question. And like many of the questions Mary Beth mentioned, it really comes down to the states. States have the ability to make these funds available to those who are undocumented, but it is their decision. It is obviously super important that these funds are available to all who care for children. One strategy we encourage you to use is building coalitions with immigrant rights groups who also care about this issue and are working on it. We also ask that you please tell us, all of the partners on this call, what it is you're seeing. We really want to know how this plays out so that we can support you as effectively as we can.
And Jessica, what about legally unlicensed home-based providers?
Yep. So another great question. According to the language of the plan, if providers are eligible for the Child Care and Development Block Grant, they are eligible for relief dollars. However, it will really be, again, a state decision about who gets these dollars. So I think you're seeing the theme here, right? Your state child care administrators and the leaders in your state have some important choices to make. This is our opportunity to go back to the states and to let them know what children, families, and educators need.
Thank you, Jessica. The 39 billion in American Rescue Plan is great. But Lucy, does this mean that we're done advocating for money, for investments, child care programs, and early childhood workforce?
Thank you so much, Jacqueline, and thank you everyone who is joining us today. Bienvenidas a todos. That is such an excellent question, and one that I think many of you are able to answer. We know that before the COVID pandemic, the childcare sector was in crisis. We also know that the $39 billion, along with the additional funding for childcare, has been able to provide necessary immediate support for the sector. While we are still waiting for that funding to be released, we still have to deal with a lot of the challenges that existed before the pandemic and were only worsened as a result of the pandemic. We understand that we have a workforce that is significantly undercompensated for the important work that is done every single day on behalf of young children and families. We continue to advocate for investments that increase compensation for the workforce. We must also continue to advocate at the state and the federal level for greater supports for families to be able to access childcare. As many of my co-presenters have shared today, this is an incredible celebration that we have, right? This is an incredible victory that our sector has been able to champion. However, the work is far from done. We must continue to push. We must continue to lift up our voices. It is important that many of you continue to do exactly what you are doing today, remaining connected to organizations like ours, receiving information and updates on resources and materials to help you access the resources that are coming from the federal government, as well as opportunities to continue engaging. As I said, the work continues. We need to ensure that our government understands the important work that you are doing day in and day out, regardless of what setting. So whether you are a family child care provider or a center-based provider, you are doing work that matters, that is important, and that should be compensated adequately. So we continue to push and fight for greater compensation for the workforce. We continue to push and fight for increased access to childcare for children and families. And we continue to do this in partnership with many of you who are doing this work day in and day out. And so, Jacqueline, the work is far from done, but I am confident that if we continue to do as we have done, especially over the course of the last year, in partnership, in community, and with a deep commitment to young children, families, and our communities, we will see the victory that we know is so desperately needed by our field. Thank you.
Thank you, Lucy. I'm sitting here gathering thoughts about what we have went over today. And as a child care provider, I want to reach out to every provider that is out there and challenge you guys to get in the communities, go to and join local businesses that somewhat have influence with, I want to say, influences with the officials, elected officials, and we've got to put their feet to the fire. There are so many funds out there, but if they don't take us serious, I think funding will go other places. So I encourage each and every one of the providers today to become vocal, talk to the parents. Let's just do things that we need to do so that our voices can be heard. So what do you think, Sasha?
No, I totally agree. And, we talk about how we've done all this advocating at the federal level, but ultimately it will be the state's decisions on how that money is spent. Unfortunately, in Maine, a few years ago, we banded together as family child care providers and became an official association, and we are an affiliate now under NAFCC. And we were able to make some different changes in our state by talking with the Office of Child and Family Services. We have a direct link now. We have an early childhood advisory council in Maine at the state level, and we have 2 family child care providers who hold seats. So advocate for yourself at the state level, even down into your local level. Find those early childhood advocacy groups that already exist and get on there as a family child care provider and get your voice heard.
Everyone, thank you for this time together. This was, we went over a lot in a short time. This is a huge investment, more than we've ever seen. There are so many unanswered questions at this point, but the state has a lot of decisions to make, and together we will have a crucial role in forming these decisions. There are allies all around us, and now it is the time to be active.
And this session has been recorded. We'll be sending you all some links to resources, so please stay tuned. We'll all know more in the days and weeks ahead, and we very much want to hear from you. What are the ideas that you have that are brewing? What are the barriers? We'll be advocating together at every level.
Well, we'll also be doing more sessions just for family child care educators on child care stabilization, actions in the states, and looking ahead to much more better policies and practices. Thank everyone once again for supporting us today.
Thank you to all our presenters, and thank you to Sasha and Jacqueline, our wonderful hostesses today. NAFCC looks forward to working with all of you to make these visions a reality. Enjoy your Saturday.
Great, thank you again.